People ask me every single year during the Medicare annual election period which Medicare supplement plan is going to be the best for the new year. And in this video, I'm going to break down the most popular Medicare supplement plans in 2025 and which ones are going to be best for you in the new year. My name is Christian Brindle. I'm the owner and operator of Christian Brindle Insurance Services, also known as Everything Senior Insurance, and we specialize in helping Medicare beneficiaries understanding their Medicare options and finding the best choice based on their needs and preferences. So without further ado, let's jump into these different Medicare supplement plans. So if you didn't already know already, there are a slew of different Medicare supplement plan options that are available. Now, typically, Medicare supplement plans are standardized by Medicare. What this means is the benefits are set in terms of what they're going to provide by Medicare, and the different insurance companies that are offering them are required to offer them as is, but they can determine two things. They can determine the price that you pay every month or the premium. They can also determine your rate increases on that plan as you go throughout the years, okay? Now, Medicare supplement plans are also known as Medigaps, okay? For those of you that don't know, most things in the Medicare world have more than one name. For Medicare supplement, it's also known as Medigap. Now, a Medicare supplement plan is designed to pay as a secondary to original Medicare. So it doesn't work if you have a Medicare Advantage plan, which takes the place of Medicare. It only works if you have traditional original Medicare paying as your primary, and then typically original Medicare leaves deductibles, co-insurances, and co-pays behind with really no limits to what they can charge you on the medical side. So the Medicare supplement plan is designed to come in, plug in those holes, fill in the gaps, if you will, hence the term Medigap, and then from there, between the Medicare and the Medicare supplement, you have very strong medical coverage. Now, even though there's a bunch of different types of Medicare supplement plans that exist, typically the majority of people, and in my estimation probably 99% of people, if not more, have only 1 out of 3 different Medicare supplement plans across the country. The reason for this is because most Medicare supplement plans are just not really all that viable in terms of their overall efficiency, their overall coverage for what you pay for them. There's really only 3 plans that people typically look at because they're looked at as the strongest plans, and it's not even by a wide margin, okay? So let's take a look at this, okay? So the first plan that people talk about all the time is a Medicare supplement known as the Plan F. The Plan F was actually originated in 1992, so it's a plan that's been around for a very long time. It was actually put out when the Medigap product itself was first originated. Medicare supplements have been around for many years, since Medicare was in its inception in the 60s and 70s. But the Medigap products that we know today that are named after letters were actually originated in 1992. So the Plan F comes out. The Plan F, the best way to remember it is F stands for full coverage. Between Medicare and your supplement, when you have a Plan F, you have no copays, no deductibles, and no out-of-pocket, okay? As long as Medicare pays the charge first, the Plan F will come behind it and pick up the entirety of what's left behind on the medical costs. Now, why isn't the Plan F talked about more in 2024 going into 2025? Well, the answer for that is simple. As of January 1st, 2020, there was a bill that was passed years before it called the MACRA bill that essentially made the Plan F be grandfathered away along with another plan known as the Plan C. What this means, and the rules by this, is if you were eligible for Medicare prior to 2020, you will have the option always to be able to pick up a Plan F if you so choose to do so and if you qualify for it. Most Medicare supplement plans ask health questions to determine your eligibility. So you have to be healthy enough to be able to get on them, unless it's your first time around and you're getting on Medicare the first time, to which point all health questions are waived. But if you're able to qualify for one and you were eligible for Medicare before 2020, you'll always have the option of picking up a Plan F if you so choose to do so. If you're eligible for Medicare after January 1st of 2020, the Plan F is no longer an option for you. Now, that being said, people say, well, Christian, what can be better than free, right? What can be better than 100% coverage? Well, the main idea of the Plan F is that it's full coverage, but over the years since 1992, there started to be a situation where the claims started to really rack up on these plans. The generations of people that got on them in the 90s and the early 2000s became older and older, which meant their health problems continued to arise and their claims continued to go up. And so what we saw on the Plan F is the prices started to dramatically inflate. With less new people coming in, with no new eligible people after 2020 being able to qualify for the Plan F, that did not help that situation. So nowadays, the Plan F is not really looked at as very viable in terms of an option, mainly because it's so dang expensive to compare to these other two plans we're going to be talking about. Okay, so let's kind of move over to those two. Now, the Plan G is the closest plan to the Plan F, right? It has 100% full medical coverage, just like the Plan F, with the exception of not covering what's known as your Medicare Part B deductible. Now, this deductible changes every year. At the time of recording this in 2024, it is a $240 deductible one time per year. It's an annual deductible. The 2025 deductible at the time of recording this has not been released yet, but when it is, we will make sure to put that information out for you on this channel. But this $240 deductible is essentially all you pay. So let me paint a picture for you, right? I had a client on this plan many years ago, and I've had multiple situations like this, but there's one person in particular that comes to mind that I worked with. This person got on Medicare at 65. They qualified for a plan, no health questions, no underwriting, because that's what happens when you're new to Medicare and you're open your enrollment window. He gets a Plan G. The Plan G is the plan he decides to elect to go with. His first year, he has a bad year on Medicare. He has a bad year. He has probably $500,000 to $600,000 in medical claims his first year. Back then, the Part B deductible was not quite $240. It was a little bit less, but for the sake of this story, let's just call it $240. He paid his $240 deductible and not a penny more. Between Medicare and his Plan G Medicare supplement, between the two, they took care of the rest of all of his medical bills. And I remember him calling me the year after and just profusely thanking me for showing him that plan because he couldn't believe how much it took care of all of his medical problems that he had the year before. Okay, so that's the Plan G. It's the closest thing today that you can get to full medical coverage. It's probably also the most popular overall Medicare supplement in going into 2025. And it is a very good plan and a very viable plan. But there's another plan that is very popular as well called the Plan N, and we're going to talk about that as well. The Plan N is a very, very similar coverage plan to the Plan G. It also makes you responsible for the Medicare Part B deductible, whatever it is in that calendar year, which is $240. You also have some copays and some extra charges, though, that come with the Plan N. So, for example, your doctor copays. You do have a doctor copay. So every time you see a doctor, it's an up to $20 copay. It could be less depending on the type of doctor and what they're actually doing when you go to that visit, but you do have that cost and that copay each and every time. You do have an emergency room copay of $50 every time you go to the emergency room. And then they also don't cover what's known as Medicare Part B excess charges. What this means is that if there's essentially an additional charge or some extra charges that they want to tack on top of your bill, they would not be responsible for billing that. Now, that being said, I do find it important to let you know and make sure that you're aware. Medicare Part B excess charges are very uncommon in 2024 going into 2025. Me, myself, I've actually never seen a doctor charge one. In some states, it's not even legal for them to do so. However, if they ever did charge one and you ran into a 1 in a million situation that they did, you would be on the hook for that with the Plan N. But the main things you got to be aware of with the Plan N, in my opinion, is the Medicare Part B deductible of $240, the $20 doctor copay up to $20, and the $50 emergency room copay. So you might be asking yourself, looking at these plans side by side, Christian, why would anyone go with a Plan N when they can go with a Plan G? It's better coverage, right? The whole answer to that question comes down to the fact that the price difference between the Plan G and the Plan N is an actual thing. The Plan N is a reduced premium versus the Plan G. How much of a reduced price? Well, it's really going to depend on your area. There's some areas that we look at that have only a $15 to $20 a month price difference, where the G is just only $15 to $20 more a month. There's other areas we look at that the Plan N is $50 to $60 less a month than the Plan G. So there's some areas that the Plan N is dramatically less. There's other areas where they're actually closer in price than you might originally believe with most of the viable insurance companies in that market. So the answer is, right, you know the answer is going to be Which one is better, the Plan N or the Plan G? That is where we're kind of coming to. That's the conclusion of this video. Which one is better between the two? My answer is, it is always, and I mean always, going to depend on where you are located. It's going to depend on your zip code and how steep or not so steep the price differences between the G and the N are in your particular area. If you're looking at a $10, $20, $25 price difference on a month-to-month basis between an N and a G, and you can afford the extra $20 to $25, say, in that scenario for the G, I'd probably go with the G. But if I was saving $50, $60, $70, $80 a month on an N, I might be persuaded to go that way because that's a lot of doctor visits in a given month. Now, the thing is, with a Plan N, you might be healthy today, and those doctor copays might not be something that you have to deal with today, but you might see your health change and decline over time, and those health problems might allow you to start going to the doctor more, and you might be forced to start to spend more copays at the doctor. So me personally, unless it's a very, very steep difference in premium between the N and the G in a particular area, I typically favor the G. I feel like it's less predictable. You know exactly what, I feel like it's more predictable, excuse me, and I feel like you know exactly what you're getting in terms of coverage. I feel like the N is much less predictable because it's based on your usage that determines how much your out-of-pocket is going to be. So for me, I'd give the slight edge to the Plan G even still. A lot of people talk about rate increases. All Medicare supplement plans do have rate increases each and every year based on inflation, based on your age, and based on a number of different factors. And it has been a little bit of a rumor over the years that the Plan N goes up less in price rate increases than the Plan G. The last couple of years, we have not seen that. You know, we've seen some insurance companies where the N actually goes up more than the G, or they go up the same amount. There are some insurance companies where the N goes up less than the G, but in my opinion, I believe that both of them are going to be in the same ballpark with most insurance companies. If you find a particular insurance company that can show you data that the N actually has much lower rate increases than the G, that's a different scenario, but for the most part with most insurance companies, that is not what we are seeing over the last couple of years. So I give the slight edge to the Plan G, but ultimately it does depend on where you're located, and there is a scenario for both plans depending on where you're located at and depending on your health and your situation. If you need help with a Medicare supplement plan, whether maybe you're turning 65, maybe you're on a Medicare supplement plan and you want to shop your rate and see if you can get it down, my company, Christian Brindle Insurance Services, also known as Everything Senior Insurance, is here to help. We are licensed in over 45 states. We work with a myriad of different insurance companies, so our job is to work for you and help you find the best product, the best price, and the best insurance company to work with based on your needs and preferences. Our services are free to you. There's no cost to work with us. There's no obligation to work with us. So make sure to give us a call. Our number is 801-255-5340. Again, 801-255-5340. That number can also be found down in the description of this video. One of our team members and one of our licensed agents is here on the other end of the line to help you and to provide you excellent service and to provide you with the information that you're looking for. I hope you found this video helpful. If you did, smash the like button, for the YouTube algorithm is going to help so many more people on Medicare just like you find this information who need to hear it desperately. You can help somebody out today by helping them find this easier. Comment your thoughts down below. Do you agree with me? Do you disagree with me? Are you more of an N person? Are you more of a G person? Are you more of a Plan F person? I'd love to have your feedback and kind of hear what you think about what I said in this video. We'd love to have a friendly dialogue with you about it. Make sure to subscribe. We put out weekly videos to help you with your Medicare. And again, reach out to us. It's Medicare annual election period that we're headed into, and we are here to help, and we'd love to help you. Again, we're licensed in 45 states, and we are here to serve. Thanks so much for watching, everybody. We'll see you next time. Happy Medicare.